actually change the view so that you see Brittany's beautiful face. And she is our sales and marketing director at the residence at Salem Woods in Salem, New Hampshire. And I do believe that our Salem Woods residents are watching today. So shout out to you guys. I miss you all. And she's going to just talk a little bit about the community, and then she'll pass it back to me, and I'll get the opportunity to talk about natural aging versus dementia. So one quick second, I want to just hit the record button and change it over to Brittany. Go ahead.
All right. Can you hear me okay, Amber? All right, great. So hello, and thank you so much, everyone, for joining tonight. Amber, thank you so much for this wonderful presentation that you're about to do for us. We really appreciate it. So my name is Brittany Talbot. I'm from the residence at Salem Woods. We offer independent living, assisted living, and memory care located here in Salem, New Hampshire. I've been with LCB. LCB is our parent company. So if Amber's referring to LCB, essentially LCB is our parent company, and we have a wide variety of communities. Each community or a couple communities will speak at the beginning of each session. So if you say, why is Brittany talking? Who is Salem Woods? And you heard from Jennifer at Pearl Street. This is all the same one. We're just working together. So I've been, again, with Salem Woods for 5 years prior to opening. If you're familiar with Salem, we're located right off exit 1 in Salem, New Hampshire. Independent living, assisted living, and memory care. I certainly, if you have any questions about anything, independent living, assisted living, and memory care, but also home care. If you want resources for day programs, please feel free to reach out to any of the LCB communities. It's not just educating you about our community, but it's also to be a resource for you and your families. Right now, for example, we have a lot of different events going on. This is one of them, but a winter stay program. If yourself or you know a senior that's kind of dreading the winter coming and they're afraid, please feel free to have them reach out to one of our communities and ask about our winter stay program. A few months, come over the summer, or the winter, and not have to worry about cooking or cleaning and snow. So definitely a great program to talk about. Lastly, go to our Facebook page, see what we're doing every day. Go to our website, a lot of great resources, a lot of great blogs. But again, kind of message here is we're here for you. We're here as a resource, and please reach out if you need anything. Our direct number here is 603-890-0580. Or you can go online to www.residencesalemwoods.com. So again, thank you for your time tonight. Amber, thank you so much, and I hope everyone learned something tonight. Thank you.
Thank you, Brittany. Awesome. So welcome, everybody. Again, those of you that may have just popped on, I'm Amber. I'm going to be doing the presentation today. Just a minute, I'm going to share my screen and share the presentation and go through a series of information for you. But I want to make sure everybody knows about the chat bar. So there is an option, if you're new to Zoom, if you kind of play around, you'll notice something on the side that says chat. And so if you have a question at any point, type it in and I'm happy to answer that for you. Or you can unmute yourself and ask the question as well. So I am actually going to share my screen. Bear with me. Jennifer, can you give me a thumbs up if you can see my PowerPoint? Yay, okay. Wonderful. So guys, thank you so much for popping on tonight. So this is a really cool series. We've been doing this series for a few years now, and we actually changed it up a little bit this time based on kind of the need of what you guys out in the community have saying that they want information on. So this is a 3-part dementia series. I'm Amber Evans. I am the memory care and resident engagement specialist for LCB Senior Living. Like Brittany said, we have 30 communities across New England. And some of you may know about the residents at Pearl Street, the residents at Salem Woods, or the residents at Silver Square. And that's kind of why we're invited here. So today's series is on the difference between natural cognitive aging and dementia. And I feel like this is something that's coming up a lot right now. Is this a natural aging process, or is something more going on? And so you may be on this Zoom tonight because you are interested for yourself to know this information. Maybe you're caring for somebody with a cognitive impairment and you want to know a little bit more. You might be a resource, maybe you're a social worker or the like, and you want to have a little bit more information. So I'm going to kind of cater this to all of the above to kind of support that process. So then the next two series, just so you know, we have one as well in November where we're going to dive really, really deep into what dementia is. Today's really kind of looking at the difference between natural aging and dementia, but we're going to dive a little deeper. And then another one in December, which I can give the dates at the end, on how to connect and engage with someone with Alzheimer's or dementia, which we'll talk a little bit about tonight. Okay. So lastly, I'm going to say it one more time. Welcome, everybody. This session is being recorded, and we still want it to be interactive. So feel free to ask questions, and we can certainly keep those questions confidential in the recording. So there's no problem there. All right, here's what the next hour will look like. So first, what does natural cognitive aging look like? What is mild cognitive impairment, which is actually different than natural aging? And what is dementia? We're only going to do a very quick overview. Like I mentioned, we're really going to dive into that in the next series in November. And then some ways that maybe you can prevent dementia. So there is I'm going to share, and I hope I can do it right. I'm going to share a bunch of different resources on the screen. I do have the availability to get those to you through email by Jennifer or Brittany or Kaylin, whoever invited you to this. They have the availability to send you those. So maybe this week or next week, they can send an email out with some resources, but we'll go over a little of that today. Okay, so I'm just going to kind of go. And if anybody has questions, I'll try to keep an eye out on the chat, or Jennifer, feel free to unmute yourself and give me any direction. But first things first, everyone forgets things sometimes. Everyone forgets things sometimes. How often have you misplaced your car keys, or maybe forgotten the name of someone that you just recently met, or forgot about that appointment that you just booked the week prior? Everybody forgets things sometimes. There's a lot of things that go into play with memory that have nothing to do with dementia. A very modest degree of memory and thinking challenges are still a common part of aging. Just as our muscles atrophy as we age, our brain goes through so many changes. And so there is a degree of some cognitive challenges that is normal. It's also quite normal to have cognitive challenges when you're really stressed out. If you've got 2020, great example. We're all having our own milieu of stress in this year, and all that this year is bringing us. And so that's going to create some forgetfulness for people at any age. So people forget things sometimes, and that's okay. There is a difference, though, between normal changes with age-associated memory loss and Alzheimer's disease. And so we're going to talk a little bit about that. Some problems that could be a result of a treatable condition called reversible dementia, or what we're going to talk about called delirium. Sorry, my screen is just being silly, so hang on. There we go. So natural aging. So one of the biggest things when I'm talking with a senior or an older adult, they want to know, am I developing dementia, or is this normal? Is this normal? So let's talk about what's normal first. Almost 40% of people over the age of 65 are going to experience some sort of memory loss. I hope that gives you a sense of relief, because that's almost 40%. That's a lot of people over the age of 65 are going to have some sort of memory loss. As we age, we're going to have these subtle changes in memory that occur just as that natural aging process, just as our muscles atrophy, just as our skin wrinkles, all these sorts of things happen, and there's changes with our memory as well. If there is no medical condition that's causing that memory impairment, a new medication, we're going to talk about some things that could be, then it's simply called age-associated memory impairment. It may stay that way, it may get worse, but usually if we stay kind of in that bracket, it's just age-associated memory impairment. Mild cognitive impairment is kind of that next step, and that's not a natural form of aging, and we're going to talk about that in detail in a minute. The biggest piece for you guys to harness is that normal age-related memory loss doesn't prevent someone from living an independent life. They're still able to pay the bills on their own, to get from A to B, even to live alone. And so it's really when we start to see challenges with independence and kind of functioning in the day where we want to take a deeper look. So what could it be? There are a number of things that can cause normal age-related memory loss to be worse. So are you on a new medication? And is there a side effect to that new medication? Is there some sort of health issue that's existing or new, or maybe even flaring up that could be causing some age-related, some memory challenges to be worse? Mental health. So my background is in mental health. And this is a really big piece as it relates to memory. Anxiety, depression, and any level of trauma is going to exacerbate memory problems. I always talk about if there's some sort of trauma that happened, so I always talk about when I was in a hit and run car accident. I was fine, everything was okay. But what happened was when that hit and run happened, I couldn't remember small details like the make and model of the car, or the color of the car, or how many people were driving, or which direction it went off to after it hit me. Because what happens is the brain protects itself from those deeper memories as it relates to trauma. And we're going to talk a little bit about how emotions play into that in just a little bit. But if you're feeling high levels of anxiety, if you're feeling levels of depression, and you're having memory challenges, it could be because of that. And oftentimes we will see that, especially with PTSD. Sleep disturbances. How are we sleeping? Are we getting up in the middle of the night? Are we not getting to sleep well? Sleep disturbances are going to increase our chances of having increase that age-related memory loss. And then, of course, any other medical conditions. There's a direct correlation to our heart and our brain. So is there any sort of heart disease going on? That's certain, somebody could have a vascular dementia. That's something different. That would be a true dementia. But if you have something going on with heart health that isn't a diagnosable dementia, it could be affecting your memory. Any infections in the brain or blood clots? Was there any recent head injury? Oftentimes we can see a senior or older adult, if they've fallen, if their gait is shuffled, or if they're using a walker and it might be new for them and there was an injury, that we see an increase, obviously, in some cognitive ability. Thyroid disease, dehydration, these are all things that are going to cause somebody to have an increased risk of cognitive impairment as it relates to natural aging. Doesn't necessarily mean it's dementia. And we're going to talk about that in a minute. So this was such a big point. I'm going to say it again, and it has its own special slide. The determinant for you is, are these memory challenges beginning to consistently interfere with normal daily life activities and functioning? If they are, then it's not considered natural forms of aging. It's something different. If it's not interfering with your daily life, your activities of functioning, and you're able to independently move about the day, it's probably that 40% of folks that develop age-related memory loss. So I don't necessarily have to read through everything here, but I'm going to kind of pull upon a few things. This is not a diagnostic tool. This is really just to show a comparison to make this point a little more poignant. So normal aging, somebody might not be able to remember details of a conversation that took place a year ago. Maybe they don't remember having that conversation. Somebody with a true dementia, they are not going to remember having recent events or conversations. Normal aging, they may not be able to remember the name of an acquaintance. Tomorrow, you may not be able to remember my name. That would not necessarily be considered dementia, but natural form of aging. Dementia would be not recognizing or knowing names of family members or close friends. You can see the vast difference there. Somebody in normal aging process, they might forget things and events every once in a while. They might forget they had scheduled that doctor's appointment. But somebody with a true dementia are going to forget things and events more frequently and consistently. So you can see some of the comparisons. Occasionally, they may have word finding difficulties with normal aging. I so often will be doing presentations and I'll be trying to think of that word and where is that word, and I finally find it, right? That's something called anomia, where we have word finding difficulties. But somebody with dementia is actually going to pause, try to find the word. They may actually substitute a different word for that word, or they may start to lose their ability to speak, which is something called aphasia. And another big thing is folks in that natural aging process with natural cognitive decline, they're the ones worried about their memory, but their relatives aren't so worried. Somebody with a dementia, their support systems are concerned, but that person might not recognize that they have that cognitive impairment. Okay, I'm trying to, this silly screen. Okay, mild cognitive impairment. So let's talk about this. This is that middle of the road again. This is not a natural form of aging, and it's not dementia. So it does increase somebody's risk of developing a diagnosable dementia, but it's not necessarily considered one. So it's that stage in between. It causes, again, slight, but still noticeable and measurable decline in those cognitive abilities, including memory and thinking skills, of course. Somebody might be aware that maybe their memory has slipped. Maybe they kind of feel like, oh my gosh, something's going on. I keep forgetting things. My memory is slipping. That awareness of it typically means that isn't dementia. Dementia, we start to lose the awareness of what's going on around us. Again, these changes aren't severe enough to significantly interfere with someone's daily life. And lastly, a person with MCI does have that increased risk of developing Alzheimer's or related dementias because it is the progression. But some people with MCI never get worse. Sometimes they can stay right there. And we're going to talk about ways to prevent it from moving forward. So here's MCI. Again, I don't need to read through all of these, but you can see somebody with MCI, they still may do some of that repeating of the same stories and questions, similar to what someone with Alzheimer's disease might look like, but not as frequently. They're going to forget conversations. They might misplace things. They might become distracted and have trouble coming up with those desired words. So if you're on this Zoom tonight because you are supporting a loved one with memory loss, or if you're on this Zoom tonight because you yourself are wanting to know more for yourself, this is kind of something to look at. Do I struggle with any of these things? Somebody with MCI, and this is a really big point, is they begin to recognize my memory feels like it's slipping. I need to set up a support system. So they set up systems to support themselves to be successful in carrying out their day-to-day tasks. They may struggle with their day-to-day tasks like paying bills, taking medications, shopping, cooking, the like, but they're aware enough about that to set up systems to keep themselves in check. Whereas somebody with dementia, again, would not have that awareness. So just to kind of show you, I'm not going to, again, go into every piece of this. I'm certainly happy to share this PowerPoint with any of the communities to share out with you guys. But somebody with dementia, with a stark contrast to somebody with MCI, they're not going to be able to carry out those same skills and abilities. They're going to lose insight to their memory loss. They might get lost walking or driving in a familiar place that they've always been to. They're going to display poor judgment, right? They might walk outside in just a t-shirt on a snowy, cold day. They're not going to have an awareness that that's not okay. they're going to have a decline in rational thinking and that ability to problem solve. So you can kind of see how this is progressing, right? Natural aging, MCI into dementia. So I love this slide because I think it shows you a visual of what the difference is. So I'm going to talk about the global deterioration scale which is on the right-hand side in just a minute, as it relates to, I'm going to put it in a story so it doesn't feel so medical. But on the left-hand side, you'll see two graphs, and one shows how that natural aging process kind of begins to curve but stays there, right? So you can see, again, that's 40% of folks over age 65 develop some sort of natural cognitive impairment, natural cognitive decline. You can see the bottom, though, how somebody with Alzheimer's disease, almost does that same thing like a natural cognitive aging would, but then it starts to taper off quite drastically. The big piece to recognize on this graph, if you can see it well, is the yellow part that says diagnosis. Somebody is living for many, many years before with, let's say, Alzheimer's, for example. Somebody's living for many, many years before they even begin showing a sign or symptom. So I always use the example of Ronald Reagan. Ronald Reagan was obviously a president, and I use this scale to kind of show how this disease progresses and how it's different than normal age-related memory loss. So stage 1 of the global deterioration scale, as you see on the right, community living, unaware of changes. So Ronald Reagan was acting when he was in stage 1. He was living out in the world. He wasn't running for office yet. He was an actor. He was unaware of any sort of, ailment to his memory. But that's truly where Alzheimer's disease develops. And in the next series, next month, we're going to dive a little deeper into that. Stage 2, community living, adapts to change. So maybe now he's running for office. He thinks he's stressed out. He's got a lot on his plate. And so he adapts to that change. He hires a secretary. He has his wife take on more responsibilities for him. And he adapts to his change in cognition, truly just thinking that it's his stress level and his busy schedule, not knowing it was Alzheimer's disease. So it really isn't until about stage 3, which is where you see that yellow diagnosis, where others begin to notice and we move through a diagnosis. This is why early detection is so, so, so important. This disease is progressive. Dementia is progressive. Right now, there is no cure or treatment, but there are ways to help slow down the process. We're going to talk about that too. So community living, others notice. This is where he's our president, and he begins to show signs and symptoms of Alzheimer's disease, and it moves through it. So again, we'll dive more into this in a little bit and next month for sure, but I think this graph really shows well that difference between normal age-related memory loss and that associated with Alzheimer's disease. How we doing, guys? Maybe just anybody showing their screen, give me a thumbs up if we're doing okay. Okay, thumbs up. All right, so I always like to quiz folks, but I won't make you answer me, I'll tell you. Is dementia a disease? Is dementia a disease? So the answer is actually no. Dementia is not a disease. It's actually a symptom. It's a classification term. And we're going to talk, and you're going to see that in the next slide. And how many types of dementia exist? Obviously, just kind of think in your head. Do you think 4, 5? That's the answer I usually get. 4, 5, maybe 10. So there are actually over 100 different diseases that have the symptom of dementia. So here's an example. Dementia is an umbrella term that really describes a decline in mental ability. And so there are over 100 different diseases that are going to have that as a symptom, as cognitive decline. Here are some examples here. We're going to actually look at them here. So this is really what next month will look like. We're going to dive into what is Alzheimer's disease, what's happening to the brain, what are some ways to help, what is vascular dementia? How does it develop? So this is just a little overview to kind of show you that difference between natural aging, MCI, and dementia. But these are non-reversible dementias. These are diseases that develop that right now we don't have any cure for, but that will certainly be not a natural form of aging and are non-reversible. And you can see a little bit here, the Alzheimer's brain and what happens. So you'll see a true discoloration between that normal brain and that Alzheimer's brain. You will see that cortex really begin to shrivel, and that's where our thinking and our planning and remembering live. And so that's shrinking. But the place where it shrinks the most severe is something called the hippocampus. And the hippocampus is the part of our brain that controls logic and reason and fact. And that's the part of the brain that I was talking about before when I was in the accident. That's the part of the brain that holds what color was the car, what direction did it go. And that part of the brain doesn't function the same with dementia. It also doesn't function the same with trauma. And then you'll notice what we call ventricle-filled spaces, those fluid-filled spaces in the brain. You'll see in the slides here how open they are. So this is if there's a neural pathway that triggers and tells me I'm thirsty, it jumps to another, in a healthy brain, it jumps to one of those other neural pathway spots and says, Amber, take a drink of water. I take my drink, I take my water and I take a sip. What happens in the Alzheimer's brain is that neural pathway triggers that says I'm thirsty, and it attempts to jump to that other part of the brain for action step. But it falls off and dies off in one of those ventricle-filled spaces that you can see. And so that person never follows through with the action of taking that water, but that person is still thirsty. And so you can see how that can be really detrimental, especially living by themselves. If they're having all these neural pathways firing off, it's falling off in those ventricle-filled spaces and it's not going to action. Somebody's no longer able to take care of themselves on their own, outside of that hippocampus memory piece. So then we have something called reversible dementias. And this again is different than an irreversible dementia. And this is the thing that's most often confused with the natural aging process. So somebody may be just in over 65, have that natural aging memory loss, but something like this happens and they begin to get scared. They begin to think they have a true irreversible dementia when actually it's something called delirium, which is one of these things. So if any of these things were to happen, something to do with a medication side effect, which I'm going to talk about what that cascading effect is in a minute, high levels of depression, vitamin B12 deficiency, chronic alcoholism, and other lifestyle factors, tumors, blood clots, UTIs, this can cause something called delirium. And so it's a very rapid increase in cognitive confusion, but it can be reversed. So let's use a urinary tract infection, for example, because this is something that we see the most. I see the most happen. Somebody is in their natural aging process, no diagnosable dementia, maybe a little forgetful, maybe part of that 40%, that's normal, but they develop a UTI and maybe they try to get in their car and drive somewhere they always go and they get lost. So that's a form of delirium, and that can become really dangerous. But however, what happens is once somebody is on medication to cure that UTI, that delirium is reversed. So that can happen in a lot of different aspects. And I want to talk quickly about medication because that cascading effect can happen. So let's say we are on, I'm going to just use Aricept. Let's say somebody has a true diagnosable dementia, right? And they're on Aricept, which is a medication that some doctors prescribed for dementia. It doesn't cure it. Research is showing that it can sort of slow down the process. But now they're on Namenda or Aricept for memory, okay? And that, let's say, that gives them dry mouth, right? So now they're drinking a bunch more water, but they're having some incontinence issues, let's say, and now they have that urinary tract infection as well. So now they're on an antibiotic for that UTI, but that makes them constipated. So now they're on a stool softener, right? And the cycle continues. And now we're on a whole cocktail of medication for something that maybe isn't even slowing down the progression of the disease as much as other things can. So in modern day medicine, there is certainly no reason we don't access medication. So I have no opinion about that because it can be really helpful and powerful. But there are other things we can access as it relates to slowing down the progression of a diagnosable dementia or treating delirium that we're going to talk about a lot in the third series. You guys have to come to every one because they're going to get better and better. That's actually all about being truly engaged in your life and taking good care of yourself. So somebody could have an irreversible dementia and a reversible dementia, and that's going to continue to increase that cognitive confusion. So just a little bit more about dementia. We're going to cover a lot of this in the next presentation, but like I said, it is possible to have more than one type. My grandfather had Alzheimer's disease and vascular dementia, so you can have more than one. This one's really important. 60 to 80% of people living with a diagnosable dementia also have depression. We can speculate so many reasons why that would be, right? So we know that they're losing skills and abilities, they're losing independence, lots of different things are happening, but there's also just a somatic thing that's happening. So as we age, there's a yellowing screen that darkens as time goes on over our eyes, making it really difficult to see color contrast, to see light. At LCV, we do a ton of different things to help support that darkening screen, all the way down to the color of plates that we use in our dining program to support our residents in our memory care neighborhoods to be independent with eating and see the color contrast of the food, to the way we use the paint on the walls, to the way we have our lighting structured, to the color of the uniforms that our frontline care associates wear. So that's a whole different topic for series 3 in a few months. But what I want you to know about that darkening screen is it decreases our exposure to light. We have daylight saving time starts on Saturday, where it's going to get dark in New England at 4:30. And we all go into this little seasonal depression because we have a decreased exposure to that longer days. So that happens simply with that darkening screen that somebody can develop with dementia. So a really important tip is if you have somebody in your life that even just with that natural aging process, MCI or dementia, you want to have increased light from morning time to bedtime. It's going to get that natural serotonin, that natural endorphin, and it can help combat some of that depression non-pharmacologically. I hope that makes sense. So 35 days to make or break a habit or learn something new. It's a common misconception that somebody with dementia can no longer learn new things. They can. We all can. For you or I, for somebody without a cognitive impairment, it takes us 21 days. If you wanted to start working out or eating healthy or stop smoking or get to bed early or practice mindfulness or whatever it is, if you gave it a good 21-day shot, your brain chemistry changes and it becomes a habit. Your body will become automatic to that. Somebody with dementia can still learn, can still make new habits and break old ones. We have these ingrained deep habits that, maybe we'll never get rid of depending on, what they are. But for the most part, we can still learn new things. And it just takes us about 35 days for somebody with dementia. And if you're a caregiver here today, I hope that's hopeful for you because a lot of times when I'm working with caregivers or spouses or the adult children, they think that it's just a lost cause, and it's really not the case. We really can still have an amazing, fruitful life with the dementia diagnosis. And so it just takes a little over a month. We just got to give it a good, solid try. So we talked about this already. There is no current medication that can slow down or prevent this disease, but it does mask signs and symptoms. And so the way I think of it is if somebody has the flu, um, which is, I know if somebody's sick, we can't talk about that in 2020, but if somebody has the flu and they have a fever and a cough and body aches, they'll take Tylenol or ibuprofen, and it alleviates their fever, their cough, and their body aches maybe for a few hours, but it doesn't cure them of the flu. The flu is still going to ride its course, but it masks the signs and symptoms temporarily for them. It calms the noise. And that's what medications do for somebody with dementia that's on a memory medication. But we're going to talk about this in a few weeks, and I think it's next month, that being engaged in your life, having yourself or your loved one or whoever is prompted you to get on this Zoom tonight, having them be engaged in their life socially, emotionally, physically, and cognitively. We call that our 4 pillars at LCB, and we're going to dive deep into that later. That's going to be better than any other memory medication, because it's going to go right at the core, right? It's really going to help them from the core. So allowing them opportunities, or allowing yourself or whoever it is you're supporting opportunities to be social, to be emotionally stimulated, to get some physical activity, and to get some cognition going. That's going to be much more helpful. So I'm always asked, risk. What's the risk factors? How does this develop? And so, yes, genetics can play a role, but it's not necessarily that because my grandfather had Alzheimer's disease that I will. It can run in families, which is called familial. Otherwise, it's sporadic. If you have a lot of people in your family that were diagnosed with a dementia or of Alzheimer's disease, of course it increases that risk. But oftentimes it's sporadic, and it has to do with how old are they? The older we get, the more susceptible we become. It has to do with the environment, high stress environment, high pollutant environment, etc. It has to do with lifestyle factors. So how well we're taking care of ourselves, how well we're eating and getting good sleep and practicing good mental health and following that 4-pillar program. That's really the greatest risk. Oh, and I forgot one. Whoops, I can't go back. Well, the last slide said, how do I go back? I can do it. Affects women more than men. So yes, we are seeing statistically that women actually have an increased risk. I get a lot of questions that say, why is that? It could be because women live longer than men. And we know that this is an age, the older we get, the more susceptible. There's some research that shows that there's a relationship to estrogen and memory and what that has to do with it, but it does affect more women than it does men. So I am going to, because I know this is probably really hard for you all to see, I'm going to actually pull this up, if I can, on a different screen. So hold on one second. Can everybody see that? And we're looking at Jennifer for a thumbs up. Okay, good. 10 warning signs of Alzheimer's disease. I always get this question when I do a natural aging versus Alzheimer's disease question. How do you know the difference? And I think this is rather than hearing me ramble, this is a really clear answer. And Jennifer, Brittany, or Kaylin can get you this information. So memory loss that disrupts your daily life. That's the biggest one. Challenges in planning or solving problems. Difficulty completing familiar tasks. Confusion with time or place. We might not know what year it is, what day it is, where we are. Trouble understanding visual images and spatial relationships. So because of that darkening screen, there's all these different things that are happening to the optical nerve. We talk a lot in that we want to avoid things like dark rugs or too many patterns in our memory care neighborhoods, because it's going to disrupt that spatial relationship, and it can be very, very confusing. New problems with words or in speaking and writing. Misplacing things or losing the ability to retrace our steps. And so that's something for you. So if you walk into a room and you think, what did I just walk in here for? I can't remember what I just walked in here for. Happens to me all the time. If you have the ability to say, okay, I was just in the kitchen, I was making dinner, I'm getting ready to go pick so-and-so up from so-and-so, and I was coming in here to, right? You're retracing your steps. You have the ability to put yourself in proximity of what's going on around you. You may not come back to what you were looking for in that room. That thought, that memory may never come back. You know, it's 3 days later, you're like, oh, I was going in there because, right? But if you have the ability to retrace your steps and figure out where you are in space, it's not dementia. It's not dementia. It's high levels of stress, or it's the natural aging process. If you don't have that, if you walk into a room and somebody with dementia will walk in, forget while they're there, and either just walk out or begin to wander in that space. Decreased or poor judgment, we talked about this. Withdrawal from work or social activities. So somebody is going to begin to withdraw for a couple of reasons. One could be if they still have some sense of an awareness that they have Alzheimer's disease, they may not want you to know. They may not want you to become aware. And so they're trying to withdraw from you because of their fear that maybe you'll do something about it. So that should be a red flag for you. It also could be because social situations become extremely scary and exhausting. And so it's a natural withdrawal process. And we also see changes in mood and personality. You may say, oh, this is not my husband, or this is not my dad. They're suddenly different. Their mood, they're more irritable. Their personality has changed. That can happen, especially with frontal temporal dementia and other types like that that affect the brain differently, which we'll talk about next month. Okay, let me go to a different share. So I think I shared everything on that slide. It's kind of the same here. I just want to make sure I didn't miss anything here. Perfect. All right, let me go back. I feel so fancy knowing how to use this. Okay, share. Okay, so if there is a concern about memory loss for you or for a loved one, I often get the question, so what do I do? What's it gonna look like? And so you wanna see a doctor. And a doctor is going to review all sorts of different things. They're going to look at your medical history, and they're going to look at any medications you're on to rule any of that out first. They're going to check your blood pressure. Remember, there's a direct correlation between heart health and brain health. They're going to look at your diet and your nutrition and any drug or alcohol use to see if that's creating anything. There's a dementia called Korsakoff's syndrome, which is an alcohol-induced dementia. There is actually new research that shows if caught soon enough can be reversed a little bit. If too late, not so much. And they're going to do a little mental health screening to see if there's any sort of mental health concerns that could be causing any of the cognitive confusion. And they're going to look at tests. We typically would do something called an MMSC, which is a cognitive assessment. But if somebody has mild cognitive impairment, that typically is not picked up on an MMSE because somebody's going to score pretty high on a mini mental. And so if there is speculation that it's more than just a natural aging process, natural aging cognitive decline, the doctor would do something called a MOCA, or a Montreal Cognitive Assessment. That has a little bit more of visual spatial aspect to it. That's going to detect mild cognitive impairment a little bit better. And that's important because mild cognitive impairment can be that early detection that somebody wants. They may do brain imaging. It kind of depends on what the rest shows us. And then any sort of neurological exam that's going to have reflexes, coordination, speech, eye movement, those sorts of things. So we have 2 more slides, and then I can open it up for questions. We're doing great on time. We have about 10 minutes. But I want to pull up this. I know that you can't see that. So I want to pull up the actual information for you. This is one of my favorite things to share, and this is 10 ways to love your brain. And this is from the Alzheimer's Association. And this is all of the things you want to do or you want to encourage your loved ones to do to prevent But also, even if there is already a diagnosed dementia, this is still going to really be powerful. So break a sweat. We want to engage in cardiovascular exercise, enough that elevates your heart rate a little bit. Of course, if you have any medical condition, I'm not a doctor, you want to consult with your doctor on any of that. But again, that relationship between heart health and brain health, enough to increase the blood flow a little bit and get some of that moving. Several studies have found an association between physical activity and a reduced risk of cognitive decline. 30 minutes a day, a walk, going for a bike ride. My favorite is having a dance party with my 3-year-old. That's my exercise most days. Hit the book. So research is showing that people with more education, people who continue to be lifelong learners, however we want to look at this, helps reduce that risk of cognitive decline. So for example, maybe take a class. Maybe you're here today. What a great thing. Take a class or go to a community center, do something online. One of the beautiful things that COVID has taught us is that we are in an age of technology. Thank goodness. We have a lot at our fingertips. Could you imagine if we didn't? And so just kind of keeping up with that lifelong learning can help prevent that risk. So evidence is showing that smoking increases that risk of cognitive decline. So quitting smoking can reduce that risk at pretty comparable levels. Somebody who's never smoked, there's a vast comparison to that. We've already talked about this. There is a direct risk between cardiovascular disease, stroke, obesity, high blood pressure, and diabetes do have a direct impact to your cognitive health. So take care of your heart, your brain will follow. Brain injury. So brain injury is going to increase that risk of cognitive decline. So we're actually doing this amazing study. LCB is doing a study with a cutting edge research team right now called React Neuro. And we're working with somebody named Rudy Tanzi, who, if you've followed anything about dementia, you know him. He's a neuropsychologist and a neuroscientist who's done tons and tons of research around head injuries and dementia. Part of the folks on this team we're working with have worked a lot with the Patriots and how concussions in playing, I think I might have a question. No, I don't. I do have a question. Okay, yes, they're having technical difficulties there. Yes, we can get you a recording. And how a concussion has a direct relationship to cognitive impairment. So nonetheless, we want to make sure that our loved ones have a support system if they are in the aging process and they are starting to have any struggles with gait, that we have systems in place, whether it's occupational therapy or muscle tone help or a walker, wear your seatbelt, all those good things. So eating healthy, I know, I hate to say it, but eating healthy is going to decrease our risk. So a healthy, balanced diet that's low in fat, high in fruits and vegetables. Lots of research around 2 diets that you can look up. One called the Mediterranean diet and one called the DASH diet, which is dietary approaches to stop hypertension. And those are the 2 that really have the most research around brain health. And then sleep. Not getting enough sleep due to conditions like insomnia or sleep apnea are going to result in problems with memory and thinking and can increase someone's risk. So mental health, I know it's all the things that we're like, oh man, we know these things, right? Taking good care of yourself. So lots of studies around history of depression with an increased risk for cognitive decline. And so we want to make sure that if you are somebody that's susceptible to depression or anxiety, or any other mental health concern, that you manage your stress. I have a whole PowerPoint, a whole 1-hour presentation, maybe we could tack it on to this series at some point, that's all about self-care. And if you are on this Zoom tonight because you're a caregiver and you're caring for somebody with dementia, oftentimes you are the last person you take care of. Oftentimes you're taking care of your husband or your wife or your parent or whoever it might be, and you're putting yourself last on that list. And it's so important that you find time to take care of yourself, because you won't be around to take care of your loved one anymore if you're not taking care of yourself. And I hope that hits home to people. This is actually something I feel super passionate about sharing, because caregivers are miracle angels, and oftentimes they're putting their own health as a detriment. So I could do a whole hour talk just on that. Maybe we will, Jennifer. Maybe we tack that on at the end of one of these series. And then buddy up. So staying socially engaged is going to support your brain health. So you don't just want to, I know socializing in 2020 is hard in coronavirus COVID world, but you want to pursue activities that are meaningful to you, not just things just for the sake of it, but things that actually excite you and encourage you, whether it's singing or volunteering or, being with your grandchildren or whatever, being with your friends, however you can do that comfortably with COVID, but things that give you purpose, but staying social and engaged is important. And then lastly, things that activate your mind. So building a piece of furniture or completing a jigsaw puzzle or doing something artistic if that doesn't come naturally to me. So if I'm doing art, that's going to challenge my brain. Playing bridge, doing Sudoku, all of those things will have both short-term and long-term benefits on your brain. Okay, so I am going to try to share a video. I did this earlier, I trialed it earlier, and I had some mixed feedback about if it was heard. So I'm gonna try to play it, and I'm gonna look to Jennifer for a thumbs up or a thumbs down if it's being heard or not. Really, guys, it's everything I just said in 2 minutes, but I think it just puts a nice little bow on the presentation. So my hope is you can hear it. If you can't, I can certainly have the link sent out. But here we go. Let me just make sure my volume is up. Okay, so sorry for those of you that could not hear that. I told you I'm a child of the 80s. I'm still learning technology just like all of us. So I can certainly send the link to that video to Jennifer or whoever, Brittany or Kaylin, whoever invited you to this. And when they send resources out, they can send it. And I think the reason I like sharing it is just because it kind of simplifies everything that we just talked about, and it's easy to remember. So I am going to open up the floor for any questions. Yeah, look forward to getting the link. Okay, I'm going to open the floor for any questions. If you want to unmute yourself and ask, you're welcome to. Again, if you're like, I want to ask a question, but I don't want to be on a recording, we will have the ability to not even put that on and block that all out. Or you can use the chat box there. Or I am happy to give out my, Jennifer or Kaylin or Brittany can give you my contact information. And I'm happy to take any emails or phone calls if people want to do it that way. So I'm just going to give it a minute. And if anybody has any questions, I will answer them as best I can.
So Amber, can you hear me?
Mm-hmm.
Okay. So what might be helpful to everyone too, because I get this question so much as I am working with families that are coming to our community to, inquire about senior living care for mom or dad, is knowing, is mom or dad appropriate for assisted living or memory care? And one of the things that I always like to try to convey to families is, just because mom or dad has some signs of cognitive decline, that doesn't necessarily mean memory care. There's many supports that we can put into place in a traditional assisted living environment. Could be more verbal cueing, the care plan that the aide is, or that we're putting into place for the aide, we can put in a care plan that is going to support them, whatever cognitive deficits they have. So just, your feedback on, sometimes it's hard for families to know, is mom reflections memory care appropriate or assisted living appropriate? Thank you.
Yeah, sure. And certainly somebody living in our, what we call reflections program, which is our memory care neighborhood, we cater that whole program to work with people with a diagnosed dementia, but just to Jennifer's point, I think the biggest positive piece about moving into an assisted living, even if it's a natural, part of that natural aging process, is to participate in our 4-pillar program, because it provides all of those things that the Alzheimer's Association is saying. Are we socializing? Are we getting ourselves active? Are we doing things that stump our brain? Are we doing things that are emotionally stimulating? We have 6 to 8 programs a day that are providing that right in house. And so that in relationship to what you're saying, cueing or just another sort of little pillow of support, actually can sometimes prevent somebody from needing to move into a memory care neighborhood, because they're flourishing in a social environment that's safe, like an assisted living. I hope that answers some kind of what you're asking.
Thank you.
I appreciate it. It's so different these days. Normally I get to sit and after and chat with you all and hear your stories and have more of a one-on-one connection. So Jennifer, feel free to send my email out to everybody, and I can be a resource. And thank you all for coming tonight.